A new study says younger people are getting more colonoscopies. In 2021, the U.S. Preventative Services Task Force recommended to lower the screening age from 50 to 45. Now, this new study shows screenings among patients between 45 and 49 years old have tripled since those guidelines changed. Joining us now to talk about this and some other health stories today is Dr. Jeff Pothof. Welcome back to the program, sir. Happy to have you back. This is good news that people are following the new guidelines, right?
You know, it really is. We are seeing colon cancer happening in individuals under the age of 50, 20,000 cases diagnosed last year. So, you know, I am really a glass half full. I'm happy to see that more people are getting screened. At the same time, there's a lot of people out there, people listening right now between the ages of 45 and 49 who haven't been screened. We got to make sure they get that done. Lots of ways to do that, but detecting colon cancer early, prognosis is really favorable. If we catch it late, unfortunately not. And that's just a sad story for everyone.
I know diagnoses have been going up and up and up. Is there a reason that doctors can kind of pinpoint to be the reason behind it? Is it diet? Is it lifestyle?
Yeah, you know, we don't have definitive, but we think it's exactly that. We think our diets have changed a little bit. We may be eating things that may be, you know, more pro-cancer. Likewise, lifestyle is probably a little bit contributory in the sense that, you know, it's more difficult to find time to exercise. People are busy. So there are some reasons there, but it is concerning that we are seeing these cancers in folks under age 50. Most people in their 40s don't think about having colon cancer. Like, that's not supposed to happen to us.
Now, there is some good news when it comes to the non-invasive way to test for colon cancer. Tell me about this kind of new generation of testing that's just been given the green light.
You know, what's so great is we do have a lot of different ways to screen for colon cancer. You know, one that will be on the market next year is actually Cologuard Plus. Cologuard is actually a Wisconsin-based company, and they make it really easy to get your screening done for colon cancer. You basically receive a kit, you give them a stool sample that's mailed back to their lab, and they can let you know with a pretty high degree of sensitivity and specificity if you have colon cancer, and it's an easy way to get this done. The other good news is about 96% of people who have insurance are going to have this test free of charge, and the government requires insurance companies to pay for any follow-up testing that you need if your initial screening test is positive. So really no reason to not go out and get your colon cancer screening done.
So is this new generation more sensitive, less false positives kind of a thing?
Yeah, so more sensitive, meaning that if you have a negative test, you don't have cancer, but also important is specificity. So if you have a positive test, more likely that it's actually cancer. So we don't have people who don't have cancer having to then schedule a colonoscopy, go through all that rigmarole just to find out later that they didn't have cancer to start with. So both performing better on sensitivity and specificity.
All right, let's completely switch gears here before we let you go in 30 seconds. Arm placement seems to be really key when it comes to getting accurate blood pressure readings. So what do we need to know, whether we're doing these tests at home or at the doctor's office?
Yeah, you know, there's a few things that you need to know if you're taking your blood pressure. One, you want to be seated in a chair. You want your back supported. You want your arm at your side, and you actually want it resting on a table. And then you put the cuff on kind of by your elbow, by about heart level, and you take your pressure that way. Now, sometimes people will be laying in bed. They'll have their arm hanging at their side. What this will do is actually increase your blood pressure reading, making it look as if you might have high blood pressure, when in fact you don't. So in doctors' offices, they should be careful. They'll often get your blood pressure multiple times just to make sure they're getting good reading. But if you do take home blood pressures, you can't just do it willy-nilly. These can be affected by positioning, cuff size, things like that.
Yeah, because it could, you know, be alarming to you, and in reality, there's nothing wrong. You just did it wrong. So
Absolutely.
Good reminders there. All right, Dr. Pothof, happy to have you back. Thank you so much.
Thank you.